Good evening and thanks for joining us. As we all continue to endure unprecedented restrictions on every aspect of our lives, pressure is mounting to increase COVID-19 testing in this country. Until now, tests have mostly been restricted to people with symptoms and those who have been in close contact with an infected person. And Ontario has been lagging far behind. It has done fewer tests per capita than most other provinces. It has the ability, we're told, to test 13,000 people a day. Over the last 10 days, the most it's done is between 6,000 to fewer than 3,000 tests a day.
It's unacceptable. We say we can do 13,000 a day, then we need to start doing 13,000 every single day. The days are done of these 2,000 and 3,000 a day being tested. We have to make this happen, and we need to start doing it immediately, starting tomorrow.
That's Premier Doug Ford. Now, testing was limited at the start of this pandemic because of a lack of supplies and lab capacity everywhere. But that's since ramped up, and now there's intense pressure to test a much wider group, starting with frontline healthcare workers and employees and residents in long-term care facilities. Global's Travis Dhanraj is with me from Toronto. Travis, Doug Ford is fired up about this. Why has Ontario been so slow to ramp up testing?
Well, it's a very good question, Donna, and you could hear the frustration in the Premier's voice today. He said that he spoke with the COVID-19 command table that they have here in Toronto, and he spoke to health officials right across the province, really, saying that he wants this testing ramped up. Now, initially, the problem was we didn't have enough reagent, that there weren't enough assessment centers. That problem, as you mentioned, has been fixed. So now what health officials are saying is essentially that there is a backlog from those first tests that needed to be done, that they need to get through first. They also need to give reintroduce new guidelines for testing to public health units. Now, we know that the Premier has said that he wants long-term care residents and also long-term care workers tested, and we saw how desperately those tests are needed today at a facility here in Toronto, a long-term care facility, Seven Oaks. There were 100 patients that are either confirmed or presumptive cases of COVID-19, and almost a dozen or so healthcare workers in that facility. So the Premier says no more excuses, that this testing has to be ramped up, but only time will tell in the next couple of days whether or not that becomes a reality, Donna.
All right. Travis Dhanraj in Toronto, thanks. Alberta's Premier also wants to seriously ramp up testing there and take a much more rigorous approach to tracking returning travelers who are under mandatory orders to self-isolate. Jason Kenney is aiming for 20,000 tests a day, and he says he believes it was a mistake for Canada to wait so long to close the borders, especially to countries with high levels of infection. Tom Vernon is with me from the Alberta legislature in Edmonton. Tom, what's behind the tough new message from Premier Kenney?
Yeah, Donna, Premier Kenney says here in Alberta we're really facing a triple threat. There's obviously the public health concern when it comes to COVID-19 and the economic downturn being caused by that pandemic. But Alberta's also facing a collapse in world oil prices, which is compounding the economic issues here. Now, you mentioned he had concerns about returning international travelers. He raised these concerns last month as well. He says Alberta will provide more resources to track and quarantine and test these people as they come back, although he hasn't said exactly what that will look like. On the quarantines, to enforce that, the Premier has also suggested the idea of using cell phone technology to ensure quarantine orders are being followed. That's obviously raised some privacy concerns here in Alberta. What the Premier says these measures are for, and as we learn more details, is truly to stop the spread of the virus.
We simply cannot risk letting the virus loose in Alberta. That would create a public health catastrophe, which would force an even more stringent lockdown in the future, leaving our economy even further battered.
Tom, the Premier is also warning of 25% unemployment in Alberta and of paying some companies to take Alberta's oil. What's his strategy to try to mitigate what he calls the greatest challenge of a generation?
Yeah, Donna, that 25% unemployment number, he gave that to a business audience yesterday. That would add up to about 500,000 Albertans out of work. So some of the steps the province is suggesting, well, he said in his speech last night that he's placing much of the blame on Saudi Arabia and Russia. They have to do take a lot of the effort in reducing the amount of supply of oil on the market. But he said there more needs to be done to supply North American energy security, work on that front. Another step Premier Kenney pointed to was Alberta's investment in the Keystone XL pipeline. And getting that project moving forward. He says that will provide long-term stability here in Alberta. Opposition members here are quick to point out, though, that the Premier's vision is too narrow. He needs to look wider than just oil and gas. He needs to start talking more about diversification. Donna?
Tom Vernon in Edmonton, thanks. Well, the number of Canadians confirmed to have COVID-19 is changing rapidly. Here are the latest numbers. More than 1,300 new cases were reported today, most of them in Ontario and Quebec. With today's jump, Quebec now has more than 10,000 confirmed cases. Ontario has just over 5,200. Overall, more than 19,000 people in Canada are known to have the virus, though we know, of course, many people have not been tested yet. At least 430 people have died in Canada. Global News has learned there are no public health officers at land border crossings to test people for the virus. It's a gap in screening that potentially puts people at risk, and it raises questions about whether there's enough monitoring and enforcement at the border to detect and track people who are coming back from overseas. Mercedes Stephenson joins me now. Mercedes, BC did announce a crackdown on screening today. What can you tell us?
Well, Donna, Premier John Horgan was out, and he is telling people that they're not just expected to self-isolate, they're actually going to have to show a plan when they get to the airport or come across that border crossing saying, here is how I am going to self-isolate. If they are not satisfied with the plan that is presented, which will be treated as a legal document, then they will have a plan for you and force you into isolation. That means they are concerned, obviously, that people are coming across and presenting self-isolation plans either aren't sticking to them or they're not realistic. Take a listen to what he had to say earlier this afternoon.
They will be met by BC officials, they'll be met by federal officials, and they will be required to explain in detail with forms that will be provided on flight, forms that are also available on the web, to ensure that these legal documents are completed upon arrival and that a plan has been put in place.
Donna, there have been inconsistent applications at different border crossings and in different provinces of these quarantine orders and of the self-isolation. One of the things we learned is that there are no public health officers at land border crossings. This despite the fact that publicly the government is saying when you cross the border, if you say you have symptoms, you will be referred to a public health officer. But they are not there. And the vast majority of people coming into Canada are coming through those border crossings. That's creating a lot of concern for frontline border officers who want to have someone who they can actually refer people to who are an expert in this.
And Mercedes, Health Canada apparently warned that this tracking of returning travelers would be an issue. What do we know about that?
That's right. So in documents, there's about 1,000 pages of them that were tabled at the Health Committee. There is advice from public health officials to the minister warning that they didn't even have the resources to be able to track and enforce a quarantine order against people coming back from mainland China, let alone around the world. And we have that quote for you. We can put it up there. You can see that the federal health officials said that if this approach were to be extended to China, it would be unsustainable given the volume of travelers. Prime Minister Justin Trudeau was asked about why they didn't put more resources into public health if they were receiving warnings that early about the difficulty tracking people. This is what he had to say earlier today.
With hindsight, I'm sure there are lots of things that we would have done differently, could have done differently, but I can tell you that every step of the way, we took the advice of our medical professionals and our public health experts.
And Mercedes, you've got some information about COVID-19 potentially being weaponized by terrorist groups and others. What have we learned about that?
So, Donna, as you know, intelligence agencies are always trying to figure out every possible scenario. So this isn't to suggest that there's an imminent attack or that it's just around the corner. But the RCMP has been forwarding a memo from the United States Department of Homeland Security, who they got it from, written up by Railways in the U.S., warning that some violent extremist groups might try to exploit holes in security around hospitals and grocery stores where there's lineups of people at this time. Now, terrorism experts are saying that the virus has disrupted terror groups as well as everyone else, but they are nonetheless keeping a careful eye on this. The RCMP says they're always tracking these kinds of threats, to be careful with it. And of course, they're watching as well for frontline officers and military, who some groups are trying to encourage people to cough in their faces as a way to spread this. Fortunately, it's hard to know if you're infected with COVID-19, and if you are, you may not be well enough to go and do that. Donna?
All right, Mercedes Stephenson in Ottawa, thanks. We will continue to consult with experts and try to answer your questions. You can send them to yourquestions@globalnews.ca. And on our website, you'll find a special page dedicated entirely to COVID-19. That's at globalnews.ca/coronavirus.